Chiropractors are doctors, but are also required to be business people. As clinic owners and directors, it's important to keep the financial well-being of your clinic in mind. After all, you wouldn't be able to treat any patients to begin with if you were bankrupt and couldn't afford to keep the doors open. That being said, there are some practitioners who may lean too far into the financial side of things while leaving their oaths of the patient's best interests behind. In this video, I'll be covering some of the more common tactics that some predatory chiropractors may be using to secure their financial well-being rather than secure your health. These tactics are predatory in nature, and knowing them can help save you, the patient, tons of stress and literally thousands of dollars. In Ontario, chiropractors were once covered underneath the Provincial Health Plan, referred to as OHIP. This was good because it ensured at least a steady source of income for all chiropractors by providing a steady source of insurance to all citizens. However, in 2004, chiropractic services were dropped from OHIP. With the government no longer providing, it became difficult for some chiropractors to make ends meet, given that many patients would no longer be able to afford treatment outside of having private healthcare insurance. It's been 19 years since then, and chiropractors have pretty firmly established their role as musculoskeletal doctors, and any initial concerns about removal from OHIP have been alleviated. In 2019, 26% of Ontario citizens reported seeing a chiropractor regularly. The average was 10 visits over the duration of the past 12 months. With the COVID pandemic, the rate of people attending to a chiropractor's clinic increased even further. Patients were preferring to go see a chiropractor for their concerns rather than spending time in the ER with a potentially dangerous and deadly virus going around, or being unable to see their MDs for weeks or months at a time due to insanely long wait times. In order to survive the 19 years since being delisted by OHIP, many chiropractors turned to marketing experts or practice management experts to help survive that gap. It's also entirely possible that these strategies that they were taught were being employed beforehand, but that was a little before my time, so I can't comment on it. These practices are admittedly quite effective at securing the financial future of the chiropractor, but some of them function largely at the expense of the patient's well-being, finances, and their understanding of their health as a whole. Quick disclaimer for my chiro friends, I do not intend to bash on our profession with this video. Rather, the intention is to educate the average patient on some red flag business tactics that some chiros are definitely employing. If you've got a problem with that, you're probably one of the chiros. For the sake of simplicity, we'll use an example with low back pain. Let's look at three big and obvious tactics that you can be aware of. Number one, x-rays on initial visits. Now, there are a handful of good reasons why a chiropractor or any healthcare professional might refer you for an x-ray, referred to as a radiograph, on your first visit. The most obvious reason would be recent acute trauma. Have you fallen down the stairs? Have you been in a ski accident? Have you been in a car crash? All of those are potential really good reasons to send for an x-ray. The worst reason to send somebody for an x-ray is just because. In fact, as chiros, we're taught that x-raying for low back pain that's come on just for no specific reason in particular isn't really ethical. X-rays work by exposing the patient to radiation. While this amount is usually harmless, the intent is to expose the patient to as little radiation as reasonably achievable. This is literally referred to as the ALARA principle. If you are aware that the chiro that you're seeing x-rays every patient on their initial visit for whatever reason, that is a red flag. Carrying on, the taking of an x-ray itself isn't necessarily predatory, but it's what's done afterwards that is. Demonstration of how your alignment is off, and this is the cause of your problems. It's good form to go through any medical imaging taken of your patient with the patient so that they can better understand their condition. If the practitioner pops one x-ray up of yours and puts up a separate x-ray of what is quote-unquote a normal healthy spine, perk your ears up. If they begin drawing lines on the back of the spine to refer to the lumbar lordosis or curve, perk your ears up more. Bonus points if they begin using words like degeneration, alignment, severe, or subluxation. Bonus points if they say that you should bring your family in for treatment because they likely have a similar condition. The truth about x-rays is that the appearance of them actually has very little correlation to the patient presentation, especially when it comes to alignment. Just because your curve might be a few degrees off from what's considered a normal healthy back does not mean that it is the cause of all of your symptoms. And while there is an association between less of a lumbar curve and people with low back pain, it's entirely possible that the reduced curve is actually a symptom of whatever your underlying problem is, rather than the cause. If you do not fully grasp the difference between a symptom and a cause or a diagnosis, you can watch this video on sciatica up here where I cleared that up for you. Take it from the recent graduate with the most up-to-date modern chiropractic knowledge, There is nothing taught in modern curriculum around the idea of alignment being a cause of low back pain. This is an outdated mindset and objectively incorrect. At this point, the chiropractor may offer a solution in the form of a months-long treatment plan paid for upfront. It's not uncommon that these treatment plans may consist of 3 visits a week for 6 months in duration. Here's a really important detail that a lot of chiropractors probably don't actually want you to know. Wow, that sounds really clickbaity, but this is true. Low back pain is a self-limiting condition. That means that even if you do absolutely nothing at all, no treatment, no chiro, no drugs, you will get better given enough time. 90% of people recover from low back pain within 3 to 4 months. 70% of people recover from low back pain in 1 month, and 50% of people recover within 2 weeks. All of that without any kind of treatment or intervention. Now, of course, getting regular treatment alongside being physically healthy or fit will help move that needle down to faster recovery times. But my question is, if 90% of people are expected to make a full recovery from low back pain within 3 to 4 months, why is the treatment plan consisting of 3 treatments per week, lasting 6 months in duration? Furthermore, why would you be made to pay for that up front? This is only more true for the 50% of people who recover within 2 weeks. The most patient-centered way for a chiropractor to collect payment from his patients is on a visit-by-visit basis. This ensures that the treatment plan can be adjusted as the patient condition changes and the chiropractor gets compensated accordingly. Now, this is actually kind of unfortunate for chiros who are ethical with this payment method, as the better a job you do, the faster you get the patient better, the less you actually get paid. But hey, that's why it's important to ask for Google reviews and referrals. Or if you're trying to make a YouTube channel, likes, comments, subscribe, shares, all that good stuff. A quick aside, if you are a person who signed on to a multi-month treatment plan with a chiropractor and trying to get out of it, that chiropractor is legally obligated to refund you all the money remaining from unused treatment sessions. You can call and ask for a refund. If you start getting dicked around, threaten to report them to their licensing body. You will find that these predatory chiropractors will very quickly return you the money that you are owed rather than mess with getting their license revoked. Licensing bodies differ depending on whatever province or state that you reside in. If you live in Ontario, our licensing body is the CCO, or the College of Chiropractors of Ontario. I will leave the link to find out how to submit a complaint in my YouTube description. And I'm not afraid to do that because I practice ethically. The final predatory practice to mention, and it should be an obvious one, is false or outlandish claims.
Long story short, we hear a story too good to be true. It ain't.
The scope of practice of chiropractors involves musculoskeletal diagnosis and treatment. We are very good at figuring out what's wrong with you mechanically and treating it mechanically. However, this hasn't stopped certain individuals from making outlandish claims about treating, or in some cases, curing conditions way outside of our scope. A recent and obvious example of this, again, was with the start of the COVID-19 pandemic, where some chiropractors claimed that you could be boosting your immunity and therefore make yourself immune to COVID-19 through chiropractic manipulation. This is, as you could probably imagine, an absolutely false claim with no scientific background whatsoever to back it up. The conditions that some chiropractors who are either predatory or stupidly ignorant may claim to treat include things like autism, both verbal and nonverbal, certain neurodegenerative disorders like ALS or Parkinson's, or in some cases even cancer. Oh, and off the top of my head, also ADHD and dyslexia. I've heard those too. Again, none of which have any kind of backing. Use your gut and use your brain. If what your chiropractor is saying seems unreasonable, seek a second opinion. Always seek a second opinion. That's your right. I hope that these insights can help assist you in choosing a chiropractor who both practices ethically as well as right for you. And hey, if for whatever reason you are seeing a chiro who uses these techniques, but for whatever reason you still really like going to that individual, you are completely allowed to keep going to them. Patient preference comes first, but it's important to be aware of what's going on around you. That's all for today, guys. Thank you so much for watching. As always, I would greatly appreciate a subscription down below. It will help me to someday send my mother on vacation. You can click here for the previous video, or you can click here for the most recent one. Have yourselves great days.